And first order, we'll call the roll, please.
Yes, sir. Commissioner Davidson?
Here.
Commissioner Wilson?
Here.
Commissioner Boyd?
Here.
Commissioner McMurray?
Here.
Commissioner Gooch?
Here.
Commissioner Oliver?
Present.
Commissioner Dodd?
Here.
Chairman Dodd?
Thank you. And next, Vice Chair Wilson, if you could approve the minutes.
Yeah, I've reviewed the minutes of our last meeting. I found them to be in order, and I move for their approval.
Second. All in favor say aye.
Aye.
Any opposed? Great, thank you. I have not heard of any public comments. Have you, Carla?
No, sir, there were none.
All right, we'll move on to Director Cumbie.
All right.
Welcome back.
Yeah, good to see everyone again. Hopefully you have our February report made available to you there electronically. Your health department continues to do good work for Rutherford County, and we are proud to serve as we protect, promote, and improve the health and well-being of all people in Tennessee. I do want to note here, all our programs are operational, performing as expected. We recently did a 6-month QI review that the state does with us, and we've got perfect scores in Murfreesboro, Smyrna, and our dental clinic was the only perfect score in the entire region. So I always like to give them their due accolades when I can. I'm told it's quite remarkable for a department our size to get a perfect score on a QI review, because there's always some kind of something expired or so forth that could be found or improved upon. Flu and seasonal respiratory illnesses seem to be settling down now. We've seen 3 consecutive weeks of decline in Tennessee of outpatient visits for influenza-like illnesses. The rate in our region is currently considered moderate, and there are 2 classes above that. 3.5% of outpatient visits were due to influenza-like illness, which is just slightly above the baseline of 3.1%. So I think things are trending in the right direction. Just as Commissioner McMurray said, just in time for allergy season. So we do continue to provide free flu shots at the Rutherford County Health Department at both clinics, Murfreesboro and Smyrna, on a walk-in basis from 8 to 10 a.m. or 1 to 3 p.m. Of course, flu season can go as late as May, so if anyone would still like one of those are available. COVID-19 is also trending down nationwide. Our COVID-19 status in Rutherford County does remain low, according to the CDC's hospital admission metric. And we continue to offer free COVID-19 testing to the public by appointment there at the health department clinics. The federal government has reopened that test kits by mail program, and that number is 1-800-232-0233. If anyone would like to call and order those kits just to have on hand should they experience any illness.
Say that number again.
It is 1-800-232-0233. Just after the last time we met, the CDC Advisory Committee did make the recommendation of a spring COVID booster for adults 65 and older. And in March, the American Academy of Family Physicians endorsed that recommendation. So we'd like to let everyone know that we do have COVID vaccines available still at the health department, available on a walk-in basis from 8 to 10, 1 to 3, Monday through Friday. The Tennessee Department of Health has a community support hotline available to take questions about that booster, should anyone want to get more information. And that phone number is 615-770-6940. That runs between 8 a.m. and 5 p.m. And I did call it this week just to make sure it was active, and I was met with a friendly voice. So I want everyone to know that they can reach out to that number for more information. We continue to have the Moderna vaccine available for adults, and then we have the Pfizer vaccine available for pediatric patients 6 and under. We do have the pediatric RSV vaccine available by appointment. Anyone interested in the RSV vaccine can contact their health department, their pharmacy, primary care provider. If you'll remember, RSV season kind of ended earlier than the flu season this year. Exciting announcement, our annual community baby shower that we do is coming on Saturday, June 22nd. It'll take place once again at Patterson Park Community Center. But of course, it's open to any Rutherford County family that is expecting or has a newborn in their household. There will be informative classes on infant CPR, breastfeeding, safe sleep, and over 50 of our community partners will be there as vendors offering resources to growing families. And that's Saturday, June 22nd at Patterson Park.
What's the times of that?
To be determined, but typically we do something from like 10 to 1, or it'll be mid-morning to early afternoon. So I'll definitely get you those times. And finally, April 1st through 7th is National Public Health Week. It gives us an opportunity to remind the public about the importance of public health and the vital role it has played in adding quality and longevity to our lives. Under our roof, we have 56 county employees and 26 state employees who dedicate their time and efforts to keeping us safe, preventing disease before it occurs. But public health is truly a community effort, and we invite the public to visit your health departments, find out what services or programs are available to you. And Mr. Chairman, that does conclude our report.
Thank you. I see African American Culture Night. Did you mention that specifically when you went through? I had to take a text.
I did not. That is something that our health and educators did. I believe they did that at the YMCA. But they are great about focusing on cultural events or observations of months, and they really work with our community to kind of observe the things that they are interested in and want to learn about.
And which Y was that? YMCA?
The YMCA, probably Smyrna.
Okay.
Yeah.
Any
question?
Yes, please.
Regarding the vaccines and the need for the booster in the
Yes.
spring for population 65 and up, are you guys doing any kind of PSA about that, or how are you letting the public know?
There was not a release from Tennessee Department of Health, but we will probably add a card to the Rutherford County PIO. And last time she was great about getting that out to all their social media outlets. So we'll probably do that on your suggestion.
And my second question about the community baby fair, and you said it's open to families in Rutherford County. Is there a way to ensure that you're just servicing Rutherford County families?
Actually, we do get demographic information, but we would never exclude anyone from
Okay,
that.
just
We
curious.
really want to keep that open, so.
All right.
And we're glad to do so.
I'll entertain a motion to approve the report, then I believe you have some financial
I do have
items.
one more item, yes, sir.
So moved.
All in favor,
Also,
say aye.
Mr. Chair, since you got a perfect score on the dental,
I can afford that.
Should we vote on that?
Don't worry, I've got another platform.
Okay. We have a motion on the floor to approve the report. All in favor, say aye.
Aye.
All opposed. And everybody approve of the candy?
Just make sure you brush after this.
Yes, sir. Thank you for that.
Dental's #1 in the state. You have, I think, a couple of amendments.
I do. I have one amendment. This is the amendment to our current grant contract budget that we have with the state. If you'll recall, this is that pass-through funding that covers 46 of our contract employees. We had an increase in insurance this year that made it necessary to transfer $5,000 from the benefits and taxes line to increase that insurance line. That increase should allow us to cover future insurance increases as well. The state accountants have approved that move on their end, and if this is approved by the county commission, that would allow our finance department to bill the state for that reimbursement.
Any questions on that amendment? We'll call it amendment #1.
Motion to approve.
Second.
Any questions or discussion? Call the roll, please.
Yes, sir. Commissioner Davidson?
Yes.
Commissioner Wilson?
Yes.
Commissioner Boyd?
Yes.
Commissioner McMurray?
Yes.
Commissioner Gooch?
yes.
Commissioner Oliver?
Aye.
Chairman Dodge?
Yes.
Thank you.
Thank you. And that, there's 2 different documents, but they're all pertaining to the
Correct,
one, so
yes.
I was mistaken there. So that is your piece of business.
That is it.
Great, thank you.
Thank you,
Happy Holy Week, happy Easter. Hope you have a good
Thank you.
weekend.
Likewise.
Next, we have CCRC. I see Abby's here, so hello.
Hi.
Come on up. We're kind of informal. So y'all have the minutes for CCRC on your SharePoint. so you can be sure and go ahead and see those. So Abby Gerke, welcome.
Thank you.
I am Chairman Phil Dodd. You and I met once briefly at a tour at your building previously, and we are the Health and Ed Committee. We have the Mayor Pro Tem, or our Chairman actually, of the Commission, Jeff Phillips,
Hey, good to meet you.
and Carla Hill, who
Hey, how are
represents the
you?
Mayor's office. So we go over your minutes every month. We observe there's been transition from United Church Home to you coming on, or transitioning your role at the facility.
Yes.
And we had talked about coming to see your place, what traditions used to occur that this committee would go out to your facility. And it just evolved into, let's meet Abby. Let's come up and just allow you to introduce yourself, talk about your favorite parts about CCRC. And we would have a few questions, but I don't think there's an agenda or anything here, but we did want to meet you. So welcome aboard.
Well, thank you. One of the things, since this is health and education, that we really benefit from is how the education in this county benefits not just nursing homes, but also doctor's offices, hospitals, and whatnot, in pushing to help young people get education to be certified nurse technicians and medication technicians. Those are typically people you think are a nurse, but actually are at technician level, and they help people feed themselves or help provide care. And those are critical jobs that won't be replaced by, AI type technology, that we really appreciate how the Education Committee has steered, the high schoolers and then those who go on to community college into these careers. They're a great jump start for those that either want to make it a career. It has a lot of options for working 1 or 2 days a week or full time. So if maybe you have young children and can't work a full-time job for a few years, but then want to return to full-time and still have that career path, that's an option. And a lot of nurses start out on a medication technician level. That's a great college job. You can work weekends and put yourself through college if that's a choice you want to make, and also develop that on the ground education, learning from other nurses how it really things go, and all those tips. But really appreciate all this help in guiding our young people into careers that are stable-ish, you never know, but unlikely to be replaced by outsourcing and things of that nature. And there's a need, as we all get to a certain age, we might need help, but we also might need help if you just have a regular hospital visit for something, whether you're having a C-section or whichever. These are critical people that help your care, and we're really appreciative for the educational benefits and the education to our young people, that they're good careers to have. Good way to start.
I think Smyrna has, some certification, some programs. I don't know what
They
other
have science
schools.
education?
Yeah, and
We have it
specifically
several
the
schools.
We have,
Several
Have you coordinated, hi, I'm Hope Oliver, Commissioner. Hope Oliver, have you coordinated or spoken with the CTE director or anything with the schools?
we hired a couple, about 4 of the students,
Oh.
as they graduated. So that's how we got really
you're
connected
directly-
to
yeah,
career,
yeah.
really
Oh,
close.
wow.
And getting the next generation ready for careers in healthcare and stable employment and things of that nature. We get a lot of, well, what happens if my IT job dries up, or what happens if it's outsourced? I understand how hard it is to be young. It's hard on me when I was young, so.
And a great launching pad, like you said, to higher degrees.
And not everybody really wants to have a lengthy college path. These are still jobs that you can get with this education and support your family and have some flexibility that's not super common. If you go into retail or sales, there's not I'm going to work part-time for a few years, and then when my kid's in the school system, then I want to return to full-time without losing any position or seniority. This is something that has some flexibility that really helps the community and helps the workers get a real career path. So we're really appreciative. We love your employees.
I'm gonna pass it on to the superintendent of schools and Board of Education.
there you go. You have any questions?
No,
That was my main compliment, because,
Oh,
you know,
good,
we've been
good.
talking to these young people, and I'm like, man, they're really well educated, and, you know, on the ground training is always really helpful, but they're really doing a good job.
Yeah, well,
Really
I
proud of
noticed
them.
that the United Church Homes, you know, were struggling to some extent to get that transition concluded. You know, that's your
Yeah.
board's business. We're not intrigued, but is
It's
that
complicated,
going well?
and, you know, the staff at CCRC have done a really good job at transitioning over, changing our software around, working through little issues like the whole AP system and how to pay invoices in a timely manner without making little errors here and there. Got a lot of work.
Is Paul Johnson taking care of you? I know Paul's our commissioner on the board.
Yes.
Good, good.
You don't have to fee him. Well, I was gonna ask, the child care, how is that going?
They just had their state survey this past week. They scored, it was either 96 or 97. The thing that they not really got dinged on, but something that comes up in apparently all daycares is it used to be that you kept things like scissors in a locked box. Now it has to have a second lock. Just the flip over lock isn't good enough. You need that plus an additional lock. So we adjusted our storage to fix that, but it was a minor thing. It's a change that wasn't in the books last year, so it was a little adjustment, but they have done really well. It used to be that you kept scissors out of reach. Now you keep them locked with a padlock.
Is it just a daycare or is it 24?
No, it's just Monday through Friday daycare.
Okay.
And are y'all, some of the new folks aware that there is a daycare at CCRC? Is there, that all came out the last couple of years since y'all built it? Okay. And there was some talk of that expanding. I think that has been tamped down for a while.
Yeah, I mean, they do really, most of the kids are, you know, a lot of employee children,
Yeah.
but several community children as well, you know, but most of them are, I live next door to so-and-so and their kid goes to this daycare, so it's a lot of word of mouth kind of thing. It's a good size for the amount of staff we have and a few extras for the community.
What's the size of the daycare?
They are licensed for 28 kids. I think they have 24 right now, as there's two different classrooms, the babies and the toddlers. So as some have moved up, and that you have holes in the baby section, and then you fill up the babies, but you don't want to always fill the toddler room if they're about to transition over. It's a staffing thing. You have to have so many teachers per child depending on age. So you got to kind of balance a little bit.
So you're busy from newborns to the elderly. You've got your hands full.
It's a very fitting name for a daycare. Our daycare is called Generations Connected.
Yeah.
The daycare kids come over into the nursing home and do crafts and do activities. So we have a lot of connection between the generations, which I thought was a very fitting name for a daycare.
I was impressed when I heard that a few years ago. How's your census? Your number of folks in the facility? Or are you percentage of occupied? Or?
So we have 101 residents today. We are fairly full. We're still waiting for a certificate of occupancy for the new wing. That there were some issues with the drawings that we're working through, and some details with certificate of occupancy related to drawings, but that's the only holdup there.
It looks like some plans are being requested and moving on, so.
We got a plan for that.
Yeah. How many people does that wing hold, and are those beds, is that wing currently empty? Or
Yeah,
can't
you
use?
can't use it until you get official certificate of occupancy. It's a little different than, say, a apartment complex. It's not just the certificate, but you also have to have a state inspection from, for nursing homes. There's a ton of rules. We're the second most regulated industry there is. Nuclear power is the only one with more regulations than nursing homes. When a lot of staff that come from, say, a hospital are like, why are the rules so strict here? I'm like, because we're very, very heavily regulated, more than hospitals, more than doctors' offices, more than anybody else. except nuclear power, so it's complicated.
I had no idea.
Mhm.
And personnel, are you all staffed well?
You know, we're always.
Is it always a struggle?
It's always a struggle in that, you know, there's a lot of flexibility, you know, dealing with elderly and things like that is something that you have to have not just specialized training, but a real understanding of, you know, the differences. When you're in a hospital, you only have that patient for maybe a week, maybe 2 weeks. We live with them, work with them within our own families. So you have to have that mindset of treating our residents like family, but not getting too close. And then the sadness when this is their last chapter for a lot of people. So that mental health thing sometimes has a little higher burnout than, say, delivering babies or, you know, curing things. But the right people and the right fit, it's really more of a mission for most staff.
It's angelic to have that calling. So you have I thought you have a night shift. You're 24/7.
Yes, I have 9 active shifts. So,
And the night shift or the late shifts, I guess you have to have certified technicians at every shift. That has to be difficult to keep staffed.
and, you know, nurses as well, because we compete a lot with Vanderbilt and places of that nature, doctors' offices, because they're not open on weekends or nights. So that's a lot of competition for people that work weekends and nights and things of that nature. We have a special shift just dedicated to weekends to fill in some of those spots where people maybe they want a college job and only want to work weekends, but trying to find that right fit of the maturity to deal with the job and the emotional aspects of it. And also we have the flexibility of the schedule. It's a little complicated. But we have a really good core.
Can you tell us a little bit about your background?
So, I started out in nuclear power. That's that.
I was wondering, because that seemed like, why did she say that? Okay.
Because of the similarities in the regulations, I kind of know quite a bit about that. I did that for 14 years. And after the earthquake in Japan, countries like Germany went away from nuclear power, so that put not much of a need for our products, and transitioned over to working for Golden Living, and they move you around from place to place, experiencing different buildings, different setups and things of that nature in nursing homes before you get your license. Lived in Wisconsin and Austin, Texas, and Paducah, Kentucky, and here. And this is very close to my family, so this is a nice landing place.
Excellent. And were you employed by United Church Homes?
Yes.
For that, was all that traveling through that?
No, that was after.
Various, okay.
I had already worked here. I've been here about 6 years.
Excellent. And I see I see an audit came through that was clean, so congrats on that. I think what I've seen consistently good reports. I think that's true. Y'all
Yeah.
seem to be.
You know, paperwork is
There's a
hard, but
ding
we're
or two in the
doing.
past, but yeah.
We're trying to do really well with our paperwork. There's a lot.
Yeah.
Doing as much electronically as possible.
Yes.
We think you got a good audit.
I have a really quick question. I know you mentioned like, mental health, you know, for your staffers. Do you all have someone on staff that maybe will talk to your employees if they need to be able to decompress and things like that?
We have a social worker, but we don't have mental health services for the staff. We have a lot of mental health services for the residents. You know, different providers and connections that way, but we don't actually have somebody on the staff for the staff.
EAP program of any kind?
Do what?
Employee assistance program, any type of EAP program? Not that you know of?
Not that I know of, and I mean, I don't know what the county insurance all
Yeah,
to tell you the truth.
Yeah.
Are you with the county insurance?
Yes.
Then they probably
They
should.
probably do.
And are all your employees county employees, or is it a kind of a hybrid because they?
None of our employees are county
Okay.
employees. We're a separate entity. So we are an incorporated nonprofit. So none of our employees are county employees, but because of the county is kind enough to let us sneak in on your insurance, we get a couple little.
Yeah, I think historically that's just become a hybrid, which we have thought has worked well for some
Yeah.
years.
Because there is some differences when it comes to the training we have to provide and different parts of skills checkoffs and things like that that are a little bit different, that are requirements and different background checks and checks and whatnot before we hire anybody. There's all kinds of regulations on who we can hire, what they could do, what kind of training we have to provide that makes it a little more complicated. And then there's a whole daycare on the side, so.
And we are your landlords, so how are we doing? Are we treating y'all well? How's everything with the building and the grounds? Or
I mean, we did have a couple of challenges when it came to the snow, but we got a small little snow remover, one of those walk behind ones, which will help us clear some of the sidewalks and walking paths a little bit better. We have a better plan for making sure we have enough salt. We didn't really have a good way to distribute it in areas where people walk a lot, so we ended up tossing some out of the back of a pickup truck for lack of a better option, but
took care of
we
business?
need a better plan.
Did you have any accidents, anyone fall or anything?
Several staff fell in the parking lot. It was very, very icy, and because of our 24/7, we can't just flip off the lights and let everybody fend for themselves. It was a little bit of a challenge of getting people to work. We did find out about the Facebook page where you can request people that happen to have a car that can drive four-wheel drive to come help get our staff to work, but it was rough, but we did make it through and feed the staff, and everybody pulled together. I was really proud of them for their efforts.
I certainly forget just how 24/7 you cannot shut the lights off. There's no.
It gets
Never
very
There's not schools or anything else. It
confusing.
never stops.
That's right.
Yeah, every time an email comes out that says like, oh, well, the county's gonna take an extra holiday day off, the staff are like, what? I'm like, no, not you. You don't just go home, that's not how it works.
Well, we watched the remodeling go through. It looked like there was some pretty tough conditions that appears to have been overcome, from water dripping down the walls to the new roof and the new remodel. And so I hope all that's going well. Just again, get your C of O. That's got to be hurting you.
Yeah. So.
Well, thanks for taking some time. If anybody had any other questions or thoughts that we.
It's great to have a voice with the report.
Absolutely.
Yeah, it's a complicated business, but
If we're so removed, it's hard to see how complicated.
yeah, and like
We see black and white notes go through, and that's it.
we're in a unique position being a nonprofit, having a supportive county. A lot of nursing homes in Tennessee have been purchased by basically investment firms from other states, and they're looking to make a profit, and we're at a really lucky position to invest in the facility, the grounds, the staff, the education. We're starting a major education program. It's called Eden Alternative, and it focuses on fixing some of the issues that come up with transitioning, whether you're having dementia or a cancer diagnosis. Different mental health aspects of those transitions can be particularly difficult in helping staff understand, loneliness and boredom and alternatives. Our residents love bingo, but what other options are there to keep people engaged and occupied and connected with their friends? It's a really good program that we're lucky enough to have a lot of staff participate in and evolve into changing just little things. The smallest thing can make a real difference in the last chapter of somebody's life. So trying to identify those and make it all individualized, because I might like going into the flower garden, but somebody else, they want to go play checkers or something of that nature, or they might want to do coloring. Same thing doesn't fit for everybody.
I know in the past, I've heard, I've never attended a meeting at your facility. In the past, this board would go, if nothing else, I think just for a visit. Is that of interest to you? At some point, or if this committee wants to go, now's the time to discuss. Would we want to do a walkthrough? Is that intrusive, or?
You know, I would think that it would be a really good idea to come out for one of our community events, because one of the things that's sometimes a challenge is getting enough staff. So, for example, on the 4th of July, we take the residents outside, but we have to kind of hang out with them. Not everybody has a friend. Some of our residents have a spouse that's passed away. Some, family lives far away. Coming and interacting with the residents, especially in an event, we're always looking for people to come by and kind of get that hands-on approach. But a lot of our residents need a friend. It's just kind of how it is, and I think that would be something that we could maybe set something up, whether it's something we already have scheduled or something that you want to schedule, but seeing how these connections are formed is one of the impacts we're trying to really work on. We have lots of volunteers, and we can volunteer this whole committee.
Do you have an events calendar, or could you put us on an email to say, for the month, this is what's coming up?
Yeah,
Some of us, we try to volunteer.
Yeah, we have almost all of our events we put on Facebook. We have calendars, different events, like this coming weekend, we're doing an Easter egg giveaway. Hopefully, the front yard will be dry enough to actually hide Easter eggs, but if not, our backup plan is to hand out Easter eggs under the awning if it rains or something. I'm really hoping it dries out, but it's just a time to kind of hang out with our residents and see them doing things, but there's always one or two that just are looking for somebody to listen to their life story.
Yep.
Could you put them on your board meeting minutes, upcoming events?
Yeah.
Be a way for us to look at them.
Yeah,
so.
we'll get those.
And we could ask Paul to help us there too. I don't want to, but yeah, that would be.
Yeah.
We could look for
Good
Facebook.
idea. We got stuff going on all the time, but
Is the Facebook page just community care of Rutherford County? Or how do you?
there's community care of Rutherford County, and then we have a separate one for the daycare, because only the parents
Okay.
can get see pictures of their children and things like that for. But I think it's community care.
For Rutherford County.
Yeah, there you go.
Trey just asked
You
for
already
help.
know.
I need a friend to talk to as well, so hey, I'll come out there and talk to you.
Well, Abby, thank you. And I called last month and just dropped in, and I thought, what am I supposed to talk about? So, but we did want to meet you, and it's helped me just appreciate how significant your facility is. So
It's really an important aspect of the community. It's not just important for the residents that live there, but also the children and grandchildren. We really try to do events and things that get those kids in, because nobody wants to go someplace boring. If you have a bounce house and some Easter eggs, hey, you get all kinds of people, and that enriches the lives of our residents, but also the next generation, so that they appreciate that a nursing home is not necessarily a scary place. It's an apartment complex with some nurses. It's a good place to live.
that's 24/7.
Yeah, that too. But, when you reframe it as, this is just a place people happen to live in, they get a little bit of medicine and nursing care on the side, it changes it from, it's not a place for medical care, it's a place where people live and grow and experience other relationships and things of that nature.
Looks like we had a good St. Patrick's Day event.
thank you, Abby.
Well, thank you.
Grateful that you came and for us passing that
Are,
one candy.
are you part of the staff as well?
No, I'm actually with Leadership Rutherford. I'm just
Oh, never
observing.
mind.
Don't give her one, too.
Get one too.
Never mind.
Thank you. No, I'm really okay. Thank you.
Well, thank you. Thank you, May. Recruited a couple of volunteers.
I know, I'm gonna start signing people up.
We look
Next time I
forward-
want something, I know where to come.
Reach out to us. I know we're just your landlord. You have a board to answer to, and we don't want to intrude on that, but if we can be of assistance, or if you ever want to include us or give us any updates, and we'll be reaching out. So,
Awesome.
thank you.
Well, I appreciate it.
Indeed. I left special reports on here if Mike had anything to share. And I know the school board is on a much needed reprieve for the week, so we have no school board report. There were no financial matters that came from the Board of Education, so I was able to pull them from this agenda. So I have one new business item, if I'll start if anybody else has anything. We've tried out this room as an alternative to the big room. I like to be able to have interaction with those who might come in as not only guests, but those who may be seeking counsel from us or interacting with us. I like this format. I don't like being on a podium. I like being at a table, but it did become apparent last month that it can be stuffy in here and there's no social distancing. So I want to be sure that we're, the seven of us, and Carla and Jeff are comfortable. So I'll open the floor if we want to discuss moving to the other room. I'm open to the consensus of this group.
I don't have a preference. I'm fine either way, but it is a little more, it's easier to communicate in here than it is in there.
For me, I'm good either way, but for me personally, I like being in there. Just for instance, if someone happen to has allergies or whatnot, you don't want to make somebody with the group feel like you're about to have COVID or flu when you don't have that.
Yeah.
And it is kind of can be a little stuffy, but that's just me. I prefer to be in there. But I'll do whatever we all agree.
I know
I
hope
need to
that's
express
discomfort
concerns.
last
I
week.
think y'all saw my email. And the S2, because last time, I mean, she said she wasn't contagious, but it's a lot of coughing and everything. It got stuffy. I know I got hot, whatever. So I just was kind of like concerned.
Personally,
And then if we have multiple guests, that just makes it much hotter in here.
yeah,
I mean,
which we had a bunch of guests
we
that
had a lot
week.
last month.
I prefer here, but I don't want any one person to be uncomfortable. So I would suggest we move back to the other room. That's my suggestion. If any of us are uncomfortable, we're all uncomfortable, I guess is the way to put it.
I'm okay with it.
Doesn't matter to me either way.
Yeah.
So if we're ambivalent and someone has a strong feeling, I say we go with the strong feeling. So I'm sure the IT folks would just assume we move back to the other room. So if there's a consensus, I don't know that we need to vote, but
Chairman's discretion. Whoever room it says right there is the one we're going to.
let's move back to the big room. I just may put me a chair down on the floor with you guys.
We appreciate you.
Thanks. Thank you. That is the only new business or any other business that I had. If anyone else doesn't have anything, we have the luxury of one short meeting because budget's coming. Remind us, when is the joint meeting? What's our next meeting?
The The joint meeting is at the end of May.
May 28th.
Yes.
It's joined.
Now, I will say our next meeting here for Health and Ed, Kristen Swan from United Way will be here for a new update, and she was recently promoted.
Yep.
She's never seen
So,
it.
that's right. So outstanding, and of course, we've already had a good discussion with her once, so we'll do that again. And I believe Rutherford County Schools is gonna have their Atlas Program Director here. So that'll be on the books to discuss next month, which is really good. And of course, then we have our following meeting will be the actual budget meeting joint with budget and the school board can be in attendance as well.
Okay, so the 23rd is in the chambers with United Way. May the 28th is joint here. I know we went out to their place one time. I have the 28th. Oh, I'm sorry.
Did you say the 23rd?
I have the 23rd for the April meeting. Anybody else?
Yep.
Okay.
In May, I have the 28th. And it's here with the chamber.
What's the date of your April meeting?
April, I have April 23rd.
That's right.
Yeah, that's the fourth Tuesday of the month.
Okay.
So May is the 28th. Is that still, that's still 5:30, right?
Correct.
That's the joint meeting, but that's at 5:30
Yeah,
still.
they're coming to our place. It's our meeting. They'll be present. We've done budgets with them. Is that the only meeting we have jointly?
That's the only scheduled meeting unless we decided that there needed to be something further. You know, last year, based on its unique situation that maintenance of effort was always being asked for, we kind of had a real joint meeting where budget actually had business done amongst their committee, and we did as well, but, you know, kind of in the same group meeting. So really depends on what the discussion is, if anyone's comfortable moving anything forward, you know, during that evening, so.
Last year, budget attended our joint meeting.
Yep, and they called their own,
Yeah.
Oh,
committee
they got one
also
in
into
afterwards.
those, so.
Yeah, they did.
So, and that, they certainly would have that option if they want to do that
I'm
again.
looking to Trey as a budget person. I don't know that that's,
Budget is scheduled to attend.
Mhm.
okay, thank you, very good.
Yes.
Perfect.
And that's the 28th.
That's really what the joint means, is
All
health and
three.
ed and budget.
Perfect, perfect, thank you. Chairman. And so I know from
Go back to my trunk.
the next couple of months, 3 months, will be pretty tough. Everyone will have budgets in all of their committees, so
Chairman, I do have one other thing I'd like to discuss.
I'll open it up.
Obviously coming up with budget, and also, I don't know where we're at on the timeline, but it was just a few months ago that Dr. Sullivan at the podium told this committee that he expected in April or May to actually come and start discussing a middle school. So that's something that could very well be on the horizon. I don't know if he's changed that. And knowing that we're gonna have real robust discussion coming up with budgets and also whatever may happen even in April on that request, I'm getting a question often. When I say often, the last 3 public meetings I had, I got the same question every time, enough where I think I'd like to ask formally that the Board of Education, when they come to us next month, have some type of answer for this. And there is many people saying with the cost of the buildings, with a middle school looking at 100 million, with a high school looking at 190 million, and all that discussion, and just how unsustainable it seems to pay these prices, right, without any new revenues coming in. The questions I keep getting is, are we looking at alternatives for buildings? And this is a quote that I got today. Carl was actually there and heard the same quote, was if a charter school can come in and service between 500 to 800 for $20 million, why are we spending $60 million on our elementary? So I think that's a important question that the public should hear an answer to. And I informed them, I said, make sure you understand the commission's role. We're asked to approve a budget. We don't have line item power veto in their regular budget. We also don't have a means to make their budget less than the year before, because maintenance of effort is something that is a state mandate. And so a lot of people don't understand some of these things. And the real question is, why are we going to spend so much money? And I think since we're about to hit a new period over the next 2 years of being asked by the Board of Education to spend hundreds of millions of dollars, I think we need to have this discussion. The public needs that question answered on why the Board of Education chooses to ask for the buildings they do. I think it's imperative, actually. Because this commission and this committee, we only have a bid request put to us for a yes or no. But I would love for them to have that discussion. I think the public needs to hear it. So that's my formal request.
What is the question?
The question is, can you explain if there is an alternate building option? Is there an option of building any less? Is there, just to have the discussion, as people want to know why the charter schools have been publicized in the paper recently, is where it came from, that they're going to have buildings that are less than $20 million servicing 800 kids. So why? So that I would like them to hear an answer, and I'd like it to be at this committee, not just a school board meeting, but actually for health and ed, since we're the ones really looking at, forthcoming requests to build these buildings. I think it's a fair question. And Commissioner Boyd, did I kind of hit that right?
Well, I mean, it kind of light went off in my head the other day in purchasing. I can't remember who was talking to us, but he was talking about a school they built in Bedford County, an elementary school, and they built it for $39 million. And was it 32? Well, I wrote down 39, but that's what it was. And I think the elementary school we built cost 58. Is that correct? And so that Bedford County, Rutherford County, so they built something different down there than we've got here.
And we have constituents asking us, and I explained to them, the Education Committee and the County Commission, we are not actually the ones requesting any certain requests for, the bids are brought to us and the decision is made by that body. So I thought it would be good to have them open that discussion up here, especially before we enter budget season and with all of the other headlines we've got going on, with us trying to find alternative revenues. I think this is imperative that we have these discussions transparent, open, and with good dialogue between us, so people understand if we're asking to spend a certain amount of money, that there's a really good substantial reason why.
And I'd like to know the difference in what a $39 million and a $58 million building is, because we all know the schools in this county. I mean, look at McFadden. How long has it been? It's been here for
75.
longer than most of us.
75 years at least.
And Central Magnet.
And Roy Walter Annex, they said it was 60 years.
62 years. I mean, Smyrna.
I'm the principal at Smyrna Middle, so.
Hey, and that was a point I brought up today when we were talking, was Smyrna Middle. I mean, it's Smyrna High School to me, but and I want to credit the administrators we've had there over the years that have made sure that school was taken care of. But I mean, I hadn't been in it in 10 years, but I guarantee you I could walk to some of the classrooms that I sat in as a high school student, and they're still in great shape. So if they were to look at that other route, are we looking at something that wouldn't last as long? It
Sure.
may wind up costing us more in the long run.
That's an excellent thing, is the drop-off in quality would require maintenance the next number of years, so therefore it's not really worth. I just think if we get that argument on the table,
Yes.
full transparency, I think for all of us, our constituents are going to ask us these questions. So just be great to just hit it up front and just kind of get that started.
And we may be building 800 student schools, and that may be a 500 student.
That's
That's the very question is.
Absolutely.
what is
Real
the
short.
That's
You got
a
it.
very good point.
Those answers, and it could be a red steel building and metal siding, and we're doing
Right.
brick and mortar.
Right.
Blackman
And-
holds 1,700. There's no way that I can hold that many students in my building. I'm sorry. Yeah.
We got the passion going.
Yeah.
Well, and that's, I hear those questions as well. It's like when we're looking at schools and they talk about we're running out of 100-acre farms and they want to go horizontal, why not vertical, and have less space kind of thing. And I think these are all,
Instead of being stuck with one design.
right, you know.
I'd like to have the discussion on the record,
That-
so we
that
can
would-
point
yeah.
people to the video and say, great robust discussion to answer a
Yep.
lot of your questions, just like last month we were able to when Shane Wickwire was here. Hey, an hour-long discussion on some of the challenges with public charter school funding. You can go watch that video, so just to have that discussion to point people to. Thank you, Chair.
Well, yes, you're welcome.
I got some of those same questions even with the high school expansions, because they're like, well, why are they still gonna be in portables if we just spending all of this money for these expansions? You know, and they're saying it's like fluff or whatever because they're still gonna be in portables, you know, so I think it does warrant conversation.
It does. That, if I could add this, the question about being in portables with expansions, they're in portables now, and the expansions are just probably going to cover the portables, and they'll be overcrowded by the time the expansion
That's what I'm saying,
gets
they'll
here.
still be in portables. Exactly.
The question about the cost of schools has come up several times in the past, and it'll be interesting to see what this school board, how it answers those questions compared to the way they have in the past. An example would be, we built Siegel High School about the exact same time period, within the same year or two, that they opened up Antioch High School. And Antioch High School is pretty much the exact same core size with athletic fields and those kind of things that Siegel was. And the answer was, go look at Antioch. That's what we did. We went and looked at Antioch, and it's a metal building. And that was the answer, is that we're building buildings that are going to last your lifetime, your kids' lifetime, your grandkids' lifetime. They'll be here, and they'll still be in pretty good shape. And that was the answer, and it satisfied the commission at that time. Doesn't mean it's going to satisfy this commission, because every commission is different. Those questions are good to ask. Also, some of the other, like Nashville-Davidson County, the schools actually probably won't build those schools. They'll go through a public building authority to build those schools. And the public building authority has some say-so in what type of building is being built. So a lot of that's taken out of the school board hands. So we do things quite differently here than some counties do. Some counties probably haven't built a school in 50 years. And when they hear that we're building a school or a school and a half or two schools every year, it's unbelievable to them to and figure out how we're possibly doing it. And it's always been a mystery to me how we've figured out how to do it for the past 30, 40 years. But this year, and you mentioned it, Mr. Chairman, about the next couple of months of budgets, you're really going to, the commission and the school board have seen eye to eye a lot of times. And what the school board wants and what the county can afford to pay may be different this time. So the questions will need to start in this committee. So we'll really have to be sharp, and we'll have to be on top of things, simply because the money that we're talking about over the next couple of years is choking. And that's the reason that we were so in tune on getting help, growth help. And it's not going to happen. It's just not going to happen this year. So it'll be up to us to figure out what to fund and what not to fund. And it'll be a tough, tough situation. It will.
We will.
But let me also
Question
say,
to
I've known this commission for almost 2 years now, and I have no doubt that we'll figure it out. It's our responsibility to do it, and by George, we'll do it. We'll figure it out. They might not get everything they want, but we'll take care of the kids. Take that to the bank. We'll take care of the kids.
Good closing remark. No other new business, I'll entertain. Motion to adjourn.
So moved.
We're adjourned.